Okay, thank you for joining me today. Today I'm going to talk about police use of Narcan for opiate overdoses. And in 2015, there were 5,404 lethal overdoses, and drug overdoses are the leading cause of accidental death according to the American Society of Addictive Medicine 2016 facts and figures. Narcan, also called naloxone, is a drug antidote that is used to treat opiate overdoses. Oftentimes, police officers are the first ones on scene, so if they can give this to the person who's overdosing, the person has a better chance of being revived. This affects me because I'm a paramedic and I respond to these calls all the time. Now I'm going to talk a little bit about how Narcan works and opiates and what they're found in. Opiates are traditionally used for pain relief, like musculoskeletal pain, chronic pain, pain from cancer treatment, post-op surgery pain. It's also, opiate is found in heroin and illegal fentanyl and carfentanil. It can be used for the overdoses can be intentional or accidental, and they can be with the prescription medications or the illegal medications. The opiates depress the central nervous system and the respiratory system, and that causes respiratory and cardiac arrest. And if that happens, the person's going to die quickly if they don't get Narcan or other appropriate treatment. Narcan is only supposed to improve breathing, not reverse the full effect of the overdose. The Narcan binds to the opiate receptors and reverses the effects on the central nervous system and the gastrointestinal system. Narcan doesn't last as long as the opiate does, so multiple doses may be given. So after Narcan's given, the patient still needs to seek medical attention. Narcan can be given through an IV. It can be given intramuscular, like through the muscle in the arm or the leg. It can be given under the skin. It can be given through the nose, intranasally. It can be nebulized into a mist for the patient to breathe in, or it can be put down a breathing tube. The starting dose for Narcan is 0.4 milligrams for IV or IM use, and it's 2 milligrams for IN or intranasally. A lot of times patients need multiple doses depending how much of the opiate they took, and it comes in a syringe like this, and you just pop the top off, and then you just twist it on, and you would attach that foam piece to the end of this, and then you can squirt it right up their nose. Very easy to use, pretty simple to understand, so pretty much anyone can give it to it. Medical personnel, bystanders, police officers. Narcan has few side effects for patients that are given it when they're not overdosing. A lot of times Narcan's given to a patient who's unconscious for an unknown reason, just to try to rule out what's causing them to be unconscious. The only adverse effects for a person who is in an opiate overdose is they could go through withdrawal symptoms. Now I'm going to talk about why police officers should give Narcan. And according to the CDC press release, expanding naloxone use could reduce overdose deaths and save lives. In rural areas, the overdose death rate is 45% higher than in urban areas. This was based in 2015. And at the time of the press release, only 12 states let EMT basics give Narcan. At that time, only advanced EMTs and paramedics could give it in the out-of-hospital setting. Now, almost 40 states have expanded to where it is allowed to be given by lay people, police officers, EMT basics. A person needs to get medical attention after they're given Narcan, so the police officers still need to have an ambulance come to transport the patient to the hospital. The American Heart Association, they incorporated Narcan into their layperson first aid, and they train anyone taking the basic first aid class how to recognize an overdose, how to call for 911, and how to treat it with Narcan or without Narcan. Community programs now give Narcan to family members. If someone is an opiate user, they can get a prescription for Narcan from their doctors, and they can get that filled so their family members can give it to them if there's an overdose. Oftentimes, police are the first on scene to overdose calls, so that's why it's important for them to have the tools to be able to take care of the patient. There's a lot of police departments that are resistant to carrying Narcan, and some of the reasons that they're resistant is because of cost. And in my opinion, the cost is going to be spent either in police or in EMS, and that all comes from taxpayer money. So it's coming from the same place. Might as well spread it out and train everyone. Another thing is, because of the recent events with police officers, a lot of police are scared that they're going to be attacked if they go and revive someone with Narcan. We all wear blue shirts. Where I work, police, fire, EMS, we all look the same. No one's going to know the difference. If anything, they're going to think we're police officers. And the first thing we're taught in EMT school is to make sure your scene is safe. That means that if you don't feel safe going into a house, you wait for the police to get there and they tell you the scene's safe. So oftentimes they're going in first. Where I work, they're automatically dispatched to possible overdose calls, so we have them there in case we need them. Oftentimes they can get there faster because of where they are in the area, so they can give the medication sooner. And another reason some police officers are resistant to giving Narcan is because they're afraid people will stop calling 911 for overdoses. But 40 states have immunity programs where if you call for an overdose, you cannot be arrested, even if you have drugs on you. And they also have programs where if you call for a friend, they can get you into a drug treatment program. Some police officers say they're not medically trained, so they shouldn't be giving medications. Almost every police department, they have AEDs that they carry in their police car. These are medical devices that they use, so I don't feel like that argument is justified, especially with how easy it is to give Narcan like I demonstrated. Family can be trained, so if family can be trained to do it, why can't police be trained? So I've outlined all the beneficial reasons of why police should use Narcan, and with all their arguments, we all look the same. It's given to restore breathing, and a lot of people think that you give it and take away the whole high, and that's not the point of Narcan. Narcan is only to get the people breathing. And officers are often sent automatically, so if they're already on scene, they can give the medications and possibly save the life of the person who's overdosing. In conclusion, I think I demonstrated the reasons why police officers should give Narcan and how it's beneficial to everyone. It can save lives, and even though Narcan is not a fix, it can help save lives and get people on the right track to get them into treatment and hopefully stop the opiate epidemic. Thank you all for coming.